Good afternoon. Thank you, KSOS, for this opportunity. My study topic was outcome of subthreshold micropulse laser in CSCR with subfoveal and juxtafoveal leak. As we all know that CSCR is a pachychoroid spectrum of disease with unknown etiology. Uh, uh, There is a serous detachment of the neurosensory retina from the retinal pigment epithelium. Earlier, it is thought that the pathophysiology is due to RPE dysfunction. Now, it is states that it is due to choroidal dysfunction. Most of the CSCR are central leaks, so it is a therapeutic challenge. Juxtafoveal and subfoveal leaks options are limited to photodynamic therapy and pharmacological treatment. The pharmacotherapy is questionable, and the unavailability of PDT, here comes the relevance of our study. The micropulse laser are repetitive shots of bursts that last for microseconds. There is an on time and an off time. The short on time that limits thermal elevation and thermal dissipation to the adjacent tissue, and a long off time that allows the tissue to cool down before the next pulse. The aim of our study is to assess the functional and anatomical outcome following micropulse laser treatment in CSCR patients with subfoveal and juxtafoveal leak. It is a retrospective study. The data collected from our EMR, 18 patients who are diagnosed to have CSCR in subfoveal and juxtafoveal leak treated with micropulse laser therapy are taken over a period of 2017 to 2023. Our inclusion criteria is duration of symptoms, the presence of SRF in SD-OCT in foveal, perifoveal, and juxtafoveal location, and the exclusion criteria is myopia more than 6 diopter, macular disorders. The diagnosis of CSCR was confirmed by fluorescent angiography and spectral domain OCT. We studied on the anatomical and functional outcome based on the reduction of central subfoveal thickness, SRF, and visual improvement. These are the data collected pre and post operatively. Based on the guidelines of subthreshold ophthalmic laser society, the titration of the power was done. In our institute, we are using Iridis IQ577 nanometer, and the micropulse laser setting is 5% duty cycle, 500 Hz, zero spacing. Spot size is 100 to 200 micron, and the duration is 200 microseconds. And the results are, out of 18 patients, 14 are females, 4 females, 14 males. Age group is between 38 to 78. The visual acuity ranges from 6/6 to CF3 meter. The anatomical outcome of our study is 9 showed complete resolution of SRF post-treatment, and all patients showed significant reduction in central subfoveal thickness. And the functional outcome of our study is 4 patients with 6/6 vision and 6 patients with 6/9 vision. And 16 patients had subfoveal SRF, 1 perifoveal, 1 juxtafoveal SRF. 5 patients had poor visual outcome and showed absence of ellipsoid zone. Our studies shows a statistically significant reduction in SRF and central subfoveal thickness following subthreshold micropulse laser therapy. This is a DFA showing leak in the early phase, that increase in intensity and size after the late phases. This subfoveal SRF pre and post treatment, juxtafoveal SRF pre and post treatment, and this is chronic CSCR pre and post treatment. And the discussion is coming to the discussion. In our study, there is a significant reduction in SRF and central subfoveal thickness following micropulse laser treatment were noted. A study by KSOS et al. Showed that 532 nanometer of subthreshold micropulse laser was ineffective in CSCR and did not show notable changes in median visual acuity and SDOD parameters. 42% of the patients improved anatomically and visually. In our study, showed that 55% had excellent visual outcome and 42% improved anatomically. And the Lutriel et al. Analyzed the effect of micropulse laser therapy in a small group of 11 cases with duration of between 1 to 7 months, finding a total resolution of SRF in all cases regardless of the disease duration. Our study also has a similar outcome. The drawback of our study is number of laser sittings and the endpoint of laser are not predictable since it is a subthreshold micropulse laser therapy. In our study, out of 18 patients, 6 need multiple sittings. In chronic CCR, the morphological success of the treatment may not be accompanied by significant improvement in visual acuity. Conclusion is subthreshold micropulse laser is an effective treatment option patients with the CSCR and with the subfoveal and juxtafoveal leak. Anatomical and functional outcome following subthreshold micropulse laser in CCR with was excellent, and the functional result in subthreshold micropulse laser treatment is long-standing CSR are poor. The prolonged presence of SRF lead to retinal thinning and loss of visual acuity. These are my references. Thank you.
Good presentation. See, the thing is, how did you define chronic and acute? When do you call chronic CSR?
So more than 6 months, if there is no resolution of subretinal fluid, it is considered as chronic. And acute if less than 4 months, the resolution of SRF is present.
How long was your study?
Sir, is a retrospective study.
Okay. And in among all the patients, that 18 patients that you spoke about, did anybody have recurrent CSR?
Yes, sir.
But you not mentioned it there. There's no recurrence in any of the patients who you did the laser?
When these patients did not have any recurrence.
Okay.